That all brings us to a larger look at what can be done in the U.S. to protect frontline workers and lessen the spread of COVID-19. In a piece just published for The New Yorker, Dr. Atul Gawande writes about very specific lessons he sees from Hong Kong, Singapore, and South Korea. Dr. Gawande is a surgeon at the Brigham and Women's Hospital in Boston and the CEO of Haven, a joint healthcare venture created by Amazon, Berkshire Hathaway, and J.P. Morgan. And he's a staff writer for The New Yorker, and he joins me by Skype from Boston. Dr. Gawande, thank you so much for talking with us. So we did just hear from an ER physician and also the CEO of a hospital about how difficult conditions are for the workers in these hospitals and healthcare settings. You have been looking at lessons learned possibly from Asia. What are you finding?
First, understand what we're seeing in Italy is that the hospitals themselves have become a source of infection. By contrast, in Hong Kong and Singapore, they were able to control the infections very effectively. They had a playbook, and it worked. It managed to keep infections spreading inside hospitals to patients or to clinicians. And so we need to follow that playbook.
And what are some examples of what you saw? And you've written about this, about the type of masks they wore them and how long they wore them, about simple things like hand washing. What did you see?
Well, first of all, they started by saying when you come in to work, they would do a health check on every healthcare worker to see, do you have any symptoms like a fever, a cough, or any other kinds of flu-like symptoms? And then you would have to stay home. Number two, everybody wore a surgical mask when they came into work and kept that mask on all day, partly for the protection of the healthcare worker, but also because we are picking up infections in the community as workers ourselves, and we don't want to spread it to colleagues and to others. There's a third one is that you really need to separate the respiratory patients in their own clinics, in their own wards, if you have a respiratory symptom, from the people who have non-respiratory symptoms. Keep them out of the different teams, different line of traffic. And we need to be preparing to do all of these things.
And through all this, are you getting a better understanding of how long this virus lingers and how long it lingers on different kinds of surfaces?
Well, so it does linger long enough that we know we have to do regular cleaning, clean between each patient who comes in the room on the surfaces. But second, one of the interesting things, it also shows us that you don't have to be totally draconian. In Singapore, for example, when you had, they did not automatically quarantine everybody who were exposed to a coronavirus patient. They only sent you home to be in quarantine if you were within 6 feet of the patient for more than 30 minutes with no mask on. And that was effective. And what that tells you is that if you have a brief momentary exposure within 6 feet to someone who had coronavirus, that you don't have to fear that is necessarily going to cause the same spread. It comes from substantial time together.
So the duration of exposure, you're saying, really could make a difference?
The duration of exposure and how close you were. And of course, making sure that if you have your hands touching anything that might have secretions on it, that you're washing your hands.
And finally, Dr. Gawande, I'm sure you're aware of there's been some reporting about the debate between President Trump among some of the people around him about whether these very restrictive measures that are being put in place in the United States, state by state, may be doing more harm than good. Some people are questioning whether people will be better off if the economy, if the entire employment picture isn't allowed to collapse, and some of these restrictions are lightened up.
Well, I think in 2 weeks we're gonna see the onslaught of cases, and we're gonna understand we're not ready to lift the restrictions. What happened in Wuhan after lockdown was it was 3 to 4 weeks later that you hit the peak of the overrun of the hospitals. Then if we are successful staying at home and locking down the way we have, we should see that peak starts to come down and that we start seeing evidence of that. We'll hopefully have testing moving and more supplies, and that will allow us to begin to look at ways to get people back to work. My bottom line here is I'm so interested in what's happening in making healthcare workers safe, because if those measures make them safe, those measures will allow all of us to get back to work again.
But you're saying that's going to take several more weeks before we have any idea of that.
I expect that in the next 2 to 4 weeks, we'll understand whether these combination of measures keep us from infecting fellow colleagues and getting infections from patients. If those work, that will show us over the next few weeks ways we can start moving people back to work.
Dr. Atul Gawande, thank you so much.
Thank you.